Thank you, Sir Christopher, and it's a pleasure to serve under your chairmanship. And I would also like to congratulate my colleague, the Honourable Member for Hammersmith, for bringing this debate at such a timely time. Before I say any more, I do need to declare one of my interests that my husband is a non-executive director of the Chelsea and Westminster Hospital Trust. So I want to start by congratulating the key people who I think have made this possible, and that is the campaigners who've worked tirelessly and, as my colleague Hammersmith said, for no money for, I think, is it 7 years now, to wake up the community about the implications of the loss of, it was 4 hospitals, 2 have closed, and now we've got and then we've been living under the threat of the closure, or the closure of a lot of services and the downgrading of Charing Cross Hospital, and as my colleague from Ealing has said, the downgrading and withdrawal of services at Ealing Hospital. Now, this is important for my constituents in Brentford and Isleworth constituency in a number of ways. First of all, the residents of Chiswick, in the east side of my constituency, because for them, Charing Cross is their nearest hospital. It is the hospital they look to for all the basic services, and particularly A&E. It's the nearest to get to, it's the easiest to get to. So they have been rightly really, really angry, as have residents in Hammersmith and other points of West London, the places for which Charing Cross is the nearest and easiest hospital to get to. So they have been angry and worried about the loss of that hospital, and we had many campaigners, we had many campaign days, signing petitions, public meetings and so on in Chiswick over the last 7 years. And of course, the impact of the cuts of services and the threat of cuts of services in Charing Cross and Ealing in particular has impacted on all residents across my constituency. Many of my constituents also look to Ealing as their nearest hospital. But the other concern has been on the impact of the General Hospital in my constituency, which is the West Middlesex Hospital, part of the Chelsea and Westminster Hospital Trust, because it's been very difficult for them to be able to plan properly and for patients to know what their future is in terms of the services they may be having. Now, to be honest, the recent announcement on the ending of Saving a Healthier Future wasn't entirely a surprise. We've heard nothing for months, if not years, no new information, no new developments. But what we have seen is a growth in attendances. I think it's 11% a year at Charing Cross in recent years at A&E. We've seen more and more pressure on Ealing and Charing Cross hospitals. And now that's not entirely surprising, because debate after debate over the NHS, those of us in London but across the country have been saying, with population rising, with the withdrawal of basic primary care, with cutbacks in adult social care, and a whole host of other issues, cutbacks in mental health services, we've seen more and more pressure on accident and emergency services. So we've seen this pressure, and there's no way that we could see the loss of significant amount of accident emergency services in West London without incredible pressure on the remaining ones, long journey times for people trying to get to them with the levels of congestion that we have in London. And, this has caused major... And, of course, the other problem has been, because I have many people who work in Charing Cross, Ealing hospitals in my constituency, the lack of morale to the staff. Do people apply for jobs in those hospitals? Do people try and get any other vacancy in another hospital because they don't know how long their post will be available? So that has had an impact on the staff, on staff morale, team building, and team continuity and so on. And that's bound to have an impact on patient care, but admittedly difficult to measure impact on patient care. So, I mean, what we now need to know, given the ending of Shaping a Healthier Future, we want to know, Minister, how is the NHS estate, particularly the acute estate in North West London, how's it going to be planned in future? How's it going to be financed? It feels as if we're in a strategic vacuum at the moment. When will we know that there's going to be sufficient acute beds, which were partly going to be funded out of the original plan for Shaping a Healthier Future, is it would free up a load of capital money to be spent in other hospitals around West London, including St Mary's, Paddington, West Mid and so on. But where are the acute beds that are so desperately needed as A&E attendances are rising? How are they going to be funded? And what does it mean for the future of integrated health or integrated care organisations? So, Sir Christopher, I share the concern of colleagues across West London about the shambles that has been the initiation, the continuation and then the ending of Shaping a Healthier Future. But I share my colleagues' concern about what happens next. Thank you.